One of our major achievements has been the construction of 3 state-of-the-art cardiology centers at the Korle Bu Teaching Hospital, Komfo-Anokye Teaching Hospital, and the Tamale Teaching Hospital, in strategic partnership with the Ministry of Health. These centers are being designed to significantly expand Ghana's national capacity for cardiology and vascular interventions. They will include catheterization laboratories, hybrid theaters, recovery wards, intensive care units, consulting rooms, dedicated oxygen systems, on-site pharmacies, and investigation laboratories. Ladies and gentlemen, the Trust Fund has also facilitated the distribution of critical medical equipment, including dialysis machines, ICU beds, and patient monitors to Sunyani Teaching Hospital, Holy Family Hospital in Techiman, and the Volta Regional Hospital in Hohoe. These equipment were first received as donations from medical equipment supply companies and were subsequently distributed by the Trust Fund to facilities where they most needed. On the training of medical specialists, the Trust Fund has entered into strategic partnerships with the Ghana College of Physicians and Surgeons to expand specialist training centers and decentralize postgraduate medical education nationwide. We have also established similar collaborations with the Ghana College of Nurses and Midwives and the Ghana College of Pharmacists to train 100 specialist pharmacists and 100 nurse specialists in oncology, nephrology, cardiology, endocrinology, and neurology. The Ghana Medical Trust Fund has made a strategic investment of 36,234,475 Ghana cedis into the specialist training program as part of efforts to strengthen Ghana's specialist healthcare workforce and improve equitable access to specialist care nationwide. Through these partnerships, all regions of Ghana will benefit from expanded specialist training. These professionals being trained from all regions of Ghana will be required to serve in their local communities, ensuring that expertise is not a city-only privilege. Ladies and gentlemen, strategic partnerships remain central to our success. Our partnership with the Telecell Foundation has resulted in the provision of state-of-the-art cervical cancer screening equipment to Sefiyosu Government Hospital, Korle Bu Teaching Hospital, and the Tamale Teaching Hospital. We have also established a major partnership with Project Cure, which will facilitate the donation of medical equipment and supplies to hospitals across Ghana. And there are many more partnerships currently under development that will further expand and improve our impact. Ladies and gentlemen, I'm happy to announce that the Nationwide Patient Support Program officially rolls out in June 2026. But before that, the Board of Trustees approved the pilot phase, including 50 patients in the month of February. This allowed us to test our systems of patient onboarding, treatment monitoring, and claims management. These beneficiaries, drawn from across the country, received support for heart surgeries, brain surgeries, chemotherapy, radiotherapy, and orthopedic surgeries. Over 4.8 million has been expended in the treatment of these patients so far. Beneficiaries ranged from 6-month-old babies to 85-year-old persons, treated across 11 hospitals. Ladies and gentlemen, preparations are far advanced for the official rollout of the Patient Support Program in June 2026. Following consultations with the Technical Oversight Committee, leading subject matter experts and stakeholders, the Board of Trustees approved an initial benefit package focused on cancers. The package currently includes comprehensive support for breast cancer, cervical cancer, prostate cancer, and childhood cancers such as leukemia, lymphoma, soft tissue sarcomas, retinoblastomas, and nephroblastomas. Additional disease conditions will be included in the benefit package by the end of the year. Leading oncologists from across the country have been engaged to refine and update standard treatment pathways for these conditions. Additionally, the national medicines list have been updated to include newer and cutting-edge technologies and therapies. To benefit from support under the Trust Fund, an applicant must meet 3 basic eligibility requirements. The applicant must be a Ghanaian citizen, an active National Health Insurance card-bearing member, and must have a medical condition that falls within the approved conditions supported under the fund. It is important to clarify that patients cannot walk directly into the Secretariat to request for support. The process is digital and dignified. Applications are initiated by specialist clinicians at our enlisted hospitals via dedicated digital platforms. The patient support program will initially be delivered through 29 enlisted hospitals strategically distributed across the country to ensure equitable access for all Ghanaians. These hospitals include 1. Kolebu Teaching Hospital, Komfo-Anokye Teaching Hospital, Cape Coast Teaching Hospital, Tamale Teaching Hospital, Ho Teaching Hospital, Sunyani Teaching Hospital, the Efia-Nkwanta Regional Hospital in Takoradi, Greater Accra Regional Hospital, Eastern Regional Hospital, Winneba Trauma and Specialist Hospital, Volta Regional Hospital, Kumasi South Hospital, Northern Regional Hospital, Upper West Regional Hospital, Upper East Regional Hospital, Sefiyoso Government Hospital, Gosu Municipal Hospital, Bole Municipal Hospital, Rara Government Hospital, Holy Family Hospital in Techiman, Baptist Medical Center, University of Ghana Medical Center, popularly known as UGMC, 37 Military Hospital, International Maritime Hospital, the Bank Hospital, Trust Specialist Hospital, Uracare Multi-Specialist Hospital, the Aisha Hospital in Tamale, and last but not the least, St. Michael's Specialist Hospital here in Accra at La Paz. To support efficient implementation, the Trust Fund has developed a robust digital platform that integrates with hospital management systems for patient onboarding, clinical auditing, and claims processing. Installation and training have already commenced across participating hospitals. We have also completed a standardized costing and billing framework to ensure transparency, accountability, and uniformity in service pricing nationwide. To enhance this process, trained patient navigators have been deployed in all enlisted hospitals. These navigators are central to the success of this program. They will assist in completing enrollment forms and also assist patients and families in understanding treatment pathways and help them navigate the entire continuum of care. Distinguished ladies and gentlemen, looking ahead, our vision for the Ghana Medical Trust Fund is bold, ambitious, and transformational. First, we envision massive nationwide investment in health infrastructure and equipment. Our long-term goal is to establish comprehensive oncology and cancer centers across Ghana. This vision is informed by the current reality that Ghana remains severely constrained in oncology care capacity. As mentioned earlier, there are only 2 radiotherapy machines within the public sector and 1 in the private sector located only in Accra and Kumasi. As a result, patients from across the country must travel long distances and endure prolonged waiting periods to access care. In some cases, patients wait between 2 and 3 months before receiving treatment. Additionally, the country faces significant shortages in PET scanners, MRI machines, and other specialized technologies. It is therefore our vision to establish at least 3 comprehensive cancer centers capable of providing integrated diagnostics, chemotherapy, radiotherapy, and advanced treatment modalities, including technologies such as the gamma knife systems and state-of-the-art diagnostic centers across the country, starting with the Ridge Hospital as our pilot project. Ladies and gentlemen, the Ghana Medical Trust Fund represents more than a healthcare financing institution. It represents hope for families. It represents dignity for patients. It represents government's commitment to ensuring that no Ghanaian is denied life-saving specialized care simply because they cannot afford it. We remain committed to transparency, accountability, prudent and stewardship of public resources, and equitable access to care. I wish to thank the vision bearer, the President of the Republic of Ghana, His Excellency John Dramani Mahama, for his insight and his contribution towards the Trust Fund, the Minister of Health, Honorable Kwabena Minta Akando, for his supervision and policy direction. We appreciate our distinguished Board of Trustees, chaired by Mr. Tony Leta, for their strategic oversight on the fund's operations. Let me take this opportunity to specially thank the Chief Executive Officer of the National Health Insurance Authority, Dr. Victor Asari Bampo, for his continuous unwavering support. We are very grateful to the CEOs and medical directors in the various hospitals for the warm reception and readiness to collaborate with the Trust Fund. To our doctors, nurses, and all healthcare workers across the country, we are grateful for your dedication to providing healthcare to Ghanaians. To our development partners, Corporate Ghana, philanthropic organizations, and every individual who has supported this cause, we say God bless you for your contributions. Our doors are always open to more collaborations and partnerships. Finally, to the good people of Ghana, this trust fund belongs to us. Whether you are a corporate entity or an individual, you can help save a life today. Simply dial *255# on any mobile network operating in Ghana to contribute to the fund. Let us continue to build a Ghana where healthcare is a right, not a privilege, and where Mahama Cares is not a slogan, but a lived experience for every citizen. Thank you, and may God bless our homeland, Ghana. Thank you very much.
All right, thank you very much, Madam Adjoa Obuobia for that crisp but insightful delivery. So at this stage, as is the tradition here, we would invite questions from members of the media. In the interest of time, we urge you to expeditiously come to the microphone, identify yourself, and ask the question that you have in relation to the presentation made today or any other matter related to the Ghana Medical Trust Fund. Yes.
All right. My name is Shadrach Odamejari, Metro TV. My first question to before the question, let me also applaud her because for most of the things I had penned down, she has done a 360, and I acknowledge the work she's doing. My first one would have to be on what happens if demand exceeds available resources? Who gets the priority? And she also spoke about hinterland also getting access. Recently, I was in the Volta region where I had to drive a young girl to look for a health center to deliver. For people in such areas, you may find people who are CVA patients having NG tubes. How do we extend, we as in Mahama Care, extend its tentacles to also meet their needs so that before we find them, they may not be dead or too late? And other critics also on the fact that such interventions are mostly political and not as it's been said here. So what is the assurance and how do we ensure that...
when you say it's political, I need you to clarify.
Usually we critics have only said it's lasting because it's this government or so-and-so government bringing it into power for political points. But from what she has explained, it is more about human life than politics. But I would want an assurance where we get to ensure that it is the most vulnerable assessing this, not the most connected. Thank you.
Okay. It's an important question. Thank you.
Good morning. My name is Romeo Tete. I report for Ahunto 92.3 FM. Madam Administrator, I want to know how will you measure success with the program, for the program? Thank you.
Okay, how success will be measured? Sure. All right. Yeah, Hanan, we await your question.
Thank you. My name is Abdul Hanan Adam, and I work with the EIB network. Madam Obuobia, I want to find out the extent of discussion with your office and that of the Renal Patients Association of Ghana, because one of their major concerns is that even quite recently, they say there's a lot of bureaucracy in assessing help or secure support for some of the NCDs in relation to what your fund is doing. So even though you've mentioned that registration is via digital platforms, but they continuously raise the concerns about bureaucracy in terms of getting access. And my second question has to do with the allocation that was made to you in the 2026 budget. It appears what you intend to do outweighs the 2.9 million Ghana cedis that was allocated to you in the 2026 budget.
Billion, you mean?
Billion, rather, sorry. I want to find out from you, beyond the raising of funds from corporate Ghana and donations, how do you intend to get other funding to support what you are doing? Because if I calculate, or if we calculate what you've done so far and what you intend to do, it appears 2.9 budgetary allocations every year is not going to help your cause. Thank you.
Thank you very much.
Thank you very much. My name is Patrick Hasport Buedu. First and foremost, I want to say that the presentation has been so good. And just a quick one. I want a clarification on the issue where the administrator said that no patient can walk directly to a facility unless he has to go through a medical, as it were, direction or referral. Before the inception of the Ghana Medical Trust Fund, we've had a lot of people who are also under the same category of ailment that's under the Ghana Medical Trust Fund. I just want to find out, with the inception of the Ghana Trust Fund, what happens to someone who has been diagnosed of that or those categories of ailment? What is the procedure? Do they have to go back to the hospital or go to a doctor?
We also require clarity with your questions. You are saying that there are people who already have ailments who have been diagnosed.
Yes.
One would assume that the diagnosis
before the inception of the Ghana Trust Fund, Ghana Medical Trust Fund.
Okay.
Yes.
So those who were diagnosed before
the introduction. Right. Yes. So is it the same procedure, or you have to go back to their doctors for them to write to the Ghana Medical Trust Fund? Thank you very much.
All right.
Thank you.
So we'll take a last question from this batch, and then she will provide answers, and we'll come back. Mind you, we'll also be taking questions from social media. So after the journalists are done, I would pose questions that I have received from Ghanaians on social media for someone. That is, provided those questions have not already been asked. Yeah, thank you.
All right. My name is Mubarak Yakubu. I work with Angel FM and GTV. My question to Madam Administrator is...
Angel FM and GTV?
Yeah, Angel TV.
Okay, yes. Exactly. Seeing as it's under my supervision, I would have been greatly alarmed.
So, Madam Administrator, well, with regards to the Mahama case, the National Health Insurance Scheme has different times struggled with delayed in reimbursement to health facilities due to funding gaps. So I want to know the measures being put in place, mechanisms that are in place to prevent the fund from becoming political dependent or underfunded in future years. Thank you.
It's an important question, except that Dr. Bampo would argue that these days they don't have problems with delayed payments. All right, so Madam Obuobia Opoku Darko will take these questions and we'll come back for another round of questions. Thank you very much.
So the first one was demands exceeding our resources. Am I right? Yes. I think that we do the actuarial analysis before we decide to deal with a particular condition. So if I may tell you, because we have decided to roll out all the cancers, actuarial analysis have been done. We know the figures that we'll be confronted with, and we are ready for it because we think that in our budget for this year, we can get that kind of money to treat these cancer patients. So everything we do is well thought of and well planned, and we are ready to roll out with the cancers. So I'm not sure that we will exceed our resources. And as I said, if we had decided to roll out with all the conditions at once, that was going to completely collapse the trust fund. And that's why when the experts came together with the board of trustees and all the subject matter experts that we were dealing with, they decided that they were not going to roll out all the conditions at once. They were going to do it one at a time. So as and when we roll out the cancers and we see how it goes, the figures and everything, then we make a decision to maybe add the cardiovascular conditions before we add the stroke, before we add. So by the time we get there, I'm sure government itself would have made a decision on how to fund the Ghana Medical Trust Fund. I always tell everybody that at the end of the day, government is treating the Ghana Medical Trust Fund as a pilot for now. I'm sure that when they see what we have done and what the figures are, eventually, I'm sure by the end of the year, government will make a decision whether we deserve a direct source of funding or whatever it is that they want to do to help us to take care of these conditions. So please keep your fingers crossed. Assurance that most vulnerable get support. I think that because the specialists are the ones that are onboarding the patients, that's helpful, because most of these specialists clearly deal with you. They know what you're going through. They even see those who need help and those who do not need help. So I'm sure that they themselves will know who to onboard and who they think that this one, I'm sure this patient can finance his or her health care. So let me leave this one out. So I'm not sure that they will have their favorites on board. I trust these specialists that we're dealing with, and especially because of the cancers, we know that these specialists, they have their patients at heart, and I'm not sure we're going to have such issues, but as and when we get it, I'm sure that we are fully equipped to deal with it. Success. I need to measure my success. I think that you should be clapping for us. For we've been in operation for 9 months, and I'm sure that if you had heard me right, we have done a lot. And I think that this is just the beginning. Going forward will be better. But I am happy about what we have done so far, and I know that if given the chance, we will do more, and the Ghana Medical Trust Fund will be the talk of the African countries and even the world. So I think that measuring what we have done for 9 months, I think that is important to see that we have come far. Renal patient associations. I haven't met them yet, but I know that we are dealing with the Kolebu Renal Center, and I think that even the head of that department is part of our subject matter experts. So I will have a conversation about that later, and I will understand the issues. Because you say that they are not being treated fairly, I need to understand the issues before I make a comment about it. Sources of funding, and that's exactly what I said earlier. I think the government itself, by the end of the year, will analyze what the trust fund has done with the budget that they've given us, as in the 20% of the National Health Insurance Levy and all the support we have gotten from individuals and corporate institutions, and then we are also talking to some funding agencies. I'm hoping that by June, going into the end of the year, we'll get some support from them also. So we are working very hard. I'm sure that if you have heard the news, just last year, between September and December, we got donations from individuals, corporate institutions I think about 6.8 million in donations from corporate institutions and individuals. We have people who simply have even put their whole monthly salary on the fund. Their whole monthly salary goes straight into our bank account. And there are people who simply think that when they contribute to this fund, its success story will be very high. So we are looking forward to more contributions. Just from the beginning of the year to this month, May, we've gotten about 7 million worth of contributions from individuals and corporate institutions, and let me give them the credit. Sometimes you don't even go to ask. You sit down and they call you to come and take a check. And I think that many people understand exactly what this fund is about, and they are not resting. They simply want to contribute, even if it's just 1 cedi of what they have. So I think for funding, we are doing well. We intend to do more. And as and when we get the funding agents, the big funding agencies to support us, I'm sure that the people of Ghana will hear about that. And then procedure for onboarding. I think that I spoke about that earlier. You have to be a National Health Insurance card-bearing member. You must also be a Ghanaian. And then there's something that we keep getting. Many people want funding to go to India, to go to abroad to get treatment. Let me announce here and now, we do not support any funding out of the borders of this country. So if you see many people tagging us on Facebook and all other networks and asking us to support a patient who wants to take a trip to India to get further treatment, please count the Ghana Medical Trust Fund out. Because that money that we spend on one patient to go to India for a treatment, we can use that for about 20 patients in country.
For clarity, what if the diagnosis shows that we simply do not have capacity present in Ghana? I do not know if we simply do not have the clarity, the capacity to treat that ailment in Ghana, and that the only way to help that person is to take him or her abroad.
That's where the Ghana Medical Trust Fund ends.
Even if the cost is within your...
Anything beyond the borders as stipulated in the Act is beyond us. Mechanism put in place for claims. What we have done is that we have really worked on that. We do not want any delays. The Act says that we should be able to pay claims within 14 days. We have told ourselves in-house that we are paying claims within 7 days because we know exactly what it means for a patient, a chronic disease patient, to be ill and waiting for money for treatment. So I think that we will not have a problem with claims. And I think that when you talk about the National Health Insurance, I'm not sure that since Dr. Victor Bampo took over, you have heard anything about delays in claims. So that is a thing of the past. Thank you.
All right. Thank you very much. So we'll take the next batch of questions. And then we'll move on to social media.
Okay, good morning. I'm Salamat Kukwa Pinto. I'm with the Despite Media. I think that she did justice to the first question, which is the impact that Ghanaians should expect a year by this time.
Okay.
The impact that Ghanaians should expect from the Mahama case. The second has to do with the funding. I would like to find out from her how is she ensuring transparency in the disbursement of resources to avoid abuse or politicization? And the third question has to do with, I want to find out from her whether there will be a public accessible database showing how the funds are going to be utilized. Thank you.
Okay, all right. So you basically are concerned about accountability and transparency. All right.
My name is Kwame Asante. I work with Tonia TV. Until the National Health Insurance levy was uncapped, there was this complaint from service providers that the authority are unable to pay the claims. Now it's been uncapped, and that's going to help the National Health Insurance Authority to be able to pay for the claims. Now that 20% from that levy is going to the Mahama Cares, are we not going back, or is it not going to take us back to the bad old days where service providers complain about payment of their claims? Thank you.
All right, it's an important question. I'm sure that at some point Dr. Victor Bampo may want to comment on that if he has the opportunity to do so. Yes, please go ahead.
Hello, good morning. I'm Sarah Pia with CTFM and Channel 1 TV. So my question has to do with the recent visit of the Vice President to your office. She tasked your team with exploring ways to extend access to the fund beyond Tamale to other areas in the northern region. So are there any plans under consideration to address this request?
So in other words, is Tamale the only place in the northern region where people can access services under the Ghana Medical Trust Fund? That is a question that she wants to know. All right.
Hello, my name is Belinda Nankwanta, and I'm with Weather TV. Now, so with the digital claims and patients management platforms, I want to know what safeguards are in place to protect patients' data and also medical privacy. And then also, how many patients does Mahama Cares expect to support in its first year, and how will the public track the program's results and spending? And a follow-up would be, if demand exceeds available funding, what criteria will be used to prioritize patients for support? Thank you.
This is separate from the earlier question about what you do when demand exceeds. So, in terms of prioritization, which ailment comes first? Essentially, that's what she's asking. Thank you. So, Madam, you are I'm not back to ask a question. I'm here to plead again that since her office is a lifeline, can we please have local translations so that Obi Anko Kasi see Embra Hospital Yakoyan or see Nkufi and answer went to me and Boyenti. If any, I don't want to mention any language, but any local translation will be considered. Thank you very much. So, Madam Obuobia, the floor is yours again.
So the first one was about abuse. I'm not sure about abusing the fund. Clearly, we have the auditors coming in, our board of trustees, all the mechanisms that will keep us in check are in place. So I'm not sure about there being any abuse. And then for these specialists who are onboarding these patients, I'm not sure that they can decide to abuse that system also. I think that's I'm not sure that anything like that will happen. And until we detect anything like that, I'm sure that it will be difficult to discuss it. And then it takes me into the accountability that you asked about. And I think that many people, we get RTIs and all, people asking us how many patients we've treated and how we should put the information out. Let's just be a bit sensitive about it, because these are medical reports of persons that we can simply not put out. But when it comes to the audit purposes and accounting purposes and all, the information is there, it's clear, and we know that we are up to date with all the disbursement and everything that we have expended from our account. So that one, we will be clear about it. But I'm not sure about waking up one morning and just publishing the names of people who have accessed the fund and then how much has been spent on them and all. And you know how many people deal with such situations. They just pick the information and deal with it anyhow. I think that for that one, we will manage it properly so that we don't have any problem like that. And 20% of the national health insurance will affect its coffers. I think that we have been for 9 months, and then I think that for last year we got a budgetary allocation. This year we have national health insurance is still paying its claims and they are not complaining. So I'm not sure yet if 20% going to the Ghana Medical Trust Fund will bring the national health insurance down. And as the minister said, maybe Dr. Azari Bambo is here, I'm sure he himself can speak for the national health insurance if the 20% that is being given to us has affected his work yet. And then the Vice President talking about Tamale and all. I'm happy to announce that we are not only operating in Tamale. We are there in the Tamale Teaching Hospital, but we are in other facilities in that zone. Northern Regional Hospital, you can access us from there. Upper West Regional Hospital, you can access us from there. Upper East Regional Hospital, we are in Bole Municipal Hospital, Baptist Medical Center, at least about 7 facilities up north. So I'm not sure it is only in the Tamale Teaching Hospital. Thank you very much. Anything I missed? And that's why I said earlier that that's why we didn't roll out all the conditions at once. We have started with the cancers, looking at the figures and how much we have, we will keep adding. But at the end of the day, I know that by the end of the year, we will account to government, and government will see exactly how much has gone into it, what we've done with it, and they themselves will make a decision for next year's budget. So I keep insisting that this is a pilot for government. It's our first year in operation, and I'm sure by the end of this year, as we account, government itself will make a decision. So I'm not sure we'll get there yet.
Thank you very much. All right. Is there any other question? we would make an exception. Pardon me, order me. All right, order me. We will take a decision on that. But Madam Obuobia, many Ghanaians on social media also have questions for you, and I would like to take a few of them, if you do not mind. Someone wants to find out whether the Ghana Medical Trust Fund has any room for persons suffering from spine-related ailments. Someone mentions cervical spondylosis, so you may want to look at that. Someone also wants to know whether persons suffering from diabetes are eligible to benefit from your outfit's financing. Someone also wants to know whether they will not go through stress in order to access your, conditions. And someone says you should publish all the medical conditions that fall under your purview as a fund. So you may want to take these questions and ask them when you go on. Well, someone also wants to know whether the recent talk about compulsory DNA testing has come to your notice, and whether it is something you will be taking on board in the event that it sees the light of day. Thank you very much. And then when you are done, please repeat the process of accessing support form, because there may be those who only recently joined us. Thank you very much.
I think you should bring your questions on. Whether we have any room for other conditions, and as I said earlier, we cannot roll out the conditions at once. So we are rolling out with the cancers, and for the cancers, I had said that breast cancer, cervical cancer, prostate, then we do the 4 childhood cancers. And then we are more interested in the childhood cancers because their success rate is very high, and it's something that we have got a lot of success story even as we roll out our pilot case, the 50 pilot cases. So we are concentrating more on the children, but all these ones, prostate, cervical, breast, we are open for it as we roll out from June. And then as we go ahead towards the end of the year, we'll add more conditions. So for the one asking about the spinal and diabetes, all of that will come on board eventually, but at least not to start.
All right. Someone also wants to know whether you have regional offices and offices. So if they happen to be in the central region,
yes,
for instance, where should they go?
Yes. As I read my speech, I had said that we have position patient navigators in all these facilities that we are working with, and so far we have 29 facilities we are working with. All the regional and teaching hospitals, including the district hospitals that are standing in for regional hospitals, i.e. 21 of them, all have patient navigators. And I want to say thank you to these facilities. They have given us spaces in their various facilities for our patient navigators to sit in the hospital so that they can be able to take care of our patients as soon as they are onboarded. So they take you through the treatment pathways. They call you when your appointment is due for your diagnostics and everything. Our patient navigators are at hand to do all that for you. We know how the processes in the hospital go sometimes. Many patients give up and go home and don't want to come back, but the patient navigators will be there with you every step on the way. So as soon as the specialist onboard you, the patient navigator gets the details on his iPad and then immediately finds you, and then the other processes are done by the patient navigator. Some of them will even go into people's homes to find out why they are not even honoring their hospital appointments. We also have regional coordinators. They are the ones who are overseeing the patient navigator. So every hospital has a patient navigator. Every region has a regional coordinator. But we do not have offices for them for now. They are all using the facilities that we are working with. I'm not sure that we will talk about offices now. I'm sure maybe at a later date. For now, let me say thank you to the medical directors and the CEOs in the various hospitals for helping us in seating these people in their various facilities.
Well, there are some Ghanaians in the diaspora who say they want to contribute.
Yes, please.
They're asking whether you have any online or mobile applications that they can contribute.
Yes, we do. And I think that our website is on, and then you can find out there, because on the website there's a button you can click to donate, and I'm sure that it's very simple.
If you do not mind repeating your short code.
Yes, *255# on all networks, and you can get through to us.
All right. Okay. All right. Thank you very much. I think that it is fair to say that all questions stand answered. Yes. So thank you very much, Madam Adjoa Obuobia-Opoku, for honoring our invitation to be present on this platform and for sharing with us the work that you've done in the few months that you have been in office and what you intend to do going forward.